I'm Olivia Reyes, and I'm a pediatric emergency specialist. Today I'm going to discuss pediatric emergency care minus the hassle, and we'll be accepting any burning questions about urgent care for today. What's the difference between urgent care and emergency medicine, or emergency consults rather? When you talk about urgent care, it's a little bit less serious as compared to the conditions that we would expect in the ER. So, for example, life-threatening conditions such as cardiac conditions or severe respiratory distress, that would usually go immediately to the ER. However, in urgent care, usually we cater to conditions that also warrant immediate attention but are not necessarily life-threatening. Maybe we can go on to our first question. Every consult usually begins with a symptom, not necessarily with a diagnosis, with a symptom. What did you go to the doctor for? Especially in children, you have to sort of also treat what they're feeling, and of course what the mother is observing at home. So if and when the colds have been there for quite a while, so more than 2 weeks, we would think of possible post-viral infection. So even after the virus has been there, sometimes your child can still have a cold, or possible allergic causes at this point already. As a pediatrician, what I would do is treat the symptom first, give a little bit of salinase to help decongest the nose if and when that is a problem, and then maybe start a trial of antihistamines like cetirizine and see the effect after a few days. I think it's very difficult for the parent or for the layperson to see if there's an organic problem, meaning kung may problema ba talaga yung bata. Is there really an illness, a physical illness that's going on? First and foremost, I would suggest a consult with a pediatrician immediately, because we can rule out the actual disease, or if a disease is there. If and when a disease is not there, the pediatrician will be able to refer to the different subspecialties, so they can actually contact or give you referrals for developmental pediatricians and psychologists alike, and that will actually be a more logical way of trying to figure out what the problem is. Yes, actually, the urgent care service is actually an ER service that tries to fill in the gap if and when your pediatrician is not available. You can walk in anytime, and there are pediatricians on duty that can actually address your complaint immediately. And after that, we do write a note back to your pediatrician telling them what we did, and in order to be able for your pediatrician to jump back in when he comes back. So when you talk about ambulatory pediatrics, this is a field of pediatrics wherein you can do procedures on an outpatient basis. However, general pediatric care is more of maintaining wellness. So these are scheduled visits, periodic visits, as recommended by the Philippine Pediatric Society. They have children need to have periodic checkups because most of them are not sick. Most of them are well, but in order to maintain that wellness, or to maintain that status of growth and protecting children from possible risks of being ill in the future, then those checkups are what falls under the general pediatric care. Okay, so this is one of the theories actually of allergy, that if and when you don't expose the immune system to the normal environment, or just a general, I guess, a bacteria that occurs in the surrounding, that there may be a predisposed risk of either having allergies or reacting more to different factors or environmental substances. as opposed to a child who's been constantly exposed to the environment already. Cleanliness actually is sometimes relative. Siguro just basic cleanliness like washing hands and proper cuffing etiquette. So for peds, we encourage children to cuff in their elbow. So when you cuff, you do this, so you don't spread the germs through your hands. So just basic things like that will actually help your child to not be infected. But in terms of being overly protective and putting the child in some sort of bubble is also not advised. Okay, so this is one of the cases actually that we would refer to a big institution, especially if it's a major trauma. So when we talk about major trauma, we talk about multiple injuries, car crashes, or falls, which are twice of the child's height or from a very significant height. That would be referred to a big hospital already. Have general pediatricians who are very well trained in controlling asthma, and we also have pulmonology specialists for very difficult to treat asthmatics. The key in asthma actually is partnership between the doctor and the child and the parent, because asthma is not managed as a single episode but as a series or as a continuing disease. It's very important that the child is seen often and to monitor the symptoms and to make sure that the correct medications for that particular time frame, because some kids may have more severe symptoms in specific times. So well, about 70 to 80% of infections are viral. So when we say viral, these illnesses are the ones that don't necessarily need antibiotics. So with the entire medical field, you see a general pulling back from immediately prescribing antibiotics because we don't want to overuse them. If we see viral infections most of the time, then why prescribe antibiotics, right? I think very important to first determine if it's a bacterial infection or a viral one. Maybe see the doctor, and sometimes they will decide based on symptomatology, fevers, and the length of time as well. So you're saying a week. Sometimes if and when the symptoms are severe, then they may be asked to take additional lab tests like swabs or a CBC at the very least. But I think the best way to start with that is to be seen by a doctor first. Again, no guarantees in medicine. Vaccines in particular have a great role in terms of preventing disease for a vast number of people. However, there's a certain fraction of the population that may have allergies to the vaccines and or may have different reactions because we're not all the same. So some kids can react to vaccines more than the others. We do not expect severe reactions to occur often, especially when the vaccines have been available on the market for a very long time, because we do post-marketing surveillance for vaccinations. But in general, vaccines are safe and the benefits really outweigh the risk. Comparing a child that has been fully vaccinated and a child that has been not given any vaccines, the child with vaccinations actually have less illnesses in this period of time. Infections occur when you're starting the December months, when it starts to rain. So actually you would want to have your influenza vaccines way before, and that's the reason why we give it before the cold months, because the viruses are there. But cold specifically does not cause illness. Okay, so no more questions at this point. If and when you may have any, you can always send them through the CMI website, Instagram, and Facebook accounts. And again, I'm Dr. Olivia Reyes, and tune in again next Wednesday for another CMI live topic. And thank you for watching this afternoon.